What do I do with this person who's not doing their practices? What do I do about this person who's defensive? So there's a lot to say about that, but I thought I'd just give you a few things to think about, fuel for thought. So one would be, that the first thing I'd like to say is that you can't make someone do something. And even encouraging them often is not really an exercise that proves to be that useful. Because if they're in a defensive position, they're going to oppose any encouragement you give them. So if you think about that, I'm sure you've done that, and we've all done that, and you've probably tried to get people, especially intimate relationships like family members and stuff, to do things and sort of encourage them, remind them, and they don't do them. So this is similar in that way, where that probably isn't going to work. So there's a couple strategies. There's two things I just wanted to share with you. One is sometimes a really good and appropriate strategy, I think, is sort of siding with their defensiveness. So a lot of practice with this, all sorts of work, but as most of you know, I do a lot of work with people with eating disorders. That's a tough line to walk often, because people obviously, part of them wants to get better and part of them is very scared of changing what they're doing. And so often, if you push back, right, you're not going to make much progress. So better would be, not in a psychological way exactly, but to sort of side with them or explore their defensive, whatever they're using to defend it. So like, I want you to do this 4 times a week. I can't do 4 times a week. So you might, originally say like, oh, sure you can, let's talk about how you can. And that's not necessarily always bad. But if that's not working, you might want to change tacks and be like, yeah, I could see how that would be really difficult for you. Can you explain to me more the difficulties? And so what you're really trying to do in these situations is trying to get people to kind of open up and explore their own reasons for their defense. So you're not really, you don't have much to say about it. You don't know why they're being defensive or what the layers are. But what you really want for them is for them to unpack it. And what you'll find often is if you can get them to unpack it, you sort of like, yeah, I can see it's very difficult. They're like, yeah, it's so hard. My mother lives with me and she's really difficult all the time. And, my dog isn't house trained and is pooping all over the house. And, my kids are starting a new school. But of course, that's not a big deal because that school actually gives me more time. You'll see them start to unpack it. So it's just something to have in mind where you don't want to completely agree with them, but you want to sort of side with them is how I think about it, for temporarily, so they can work their way back around. So that's something I've thought about over the years. And then the other thing to think about, which I thought was interesting, is sometimes we have the pull to sort of tell it like it is. So Yoga Sutras, right? That's satya, truthfulness. Like, I'm going to be truthful. I'm going to tell you that you're telling yourself lies, or I'm going to tell you that you're behaving badly, or I'm going to tell you how it really is, and then let the chips fall as they may. Which honestly in life is not the worst practice, to stay within truth. So that's a good practice to do. But there's another, in the sutras, there's another part that's ahimsa and nonviolence. And I think, the main thing about that whole area, the yamas and niyamas of the sutras, right, is to really decide how you're going to filter them. So you could just filter everything through the truth, or you could filter everything through ahimsa. And general consensus, and this is going out on a limb, but general consensus is ahimsa is more important. And I would agree with that. And of course, that's complicated to unpack. You might want to think of it as is telling them the truth right now the least violent way to go about this. And so what that leads you to often is sometimes, again, like sort of siding with them or going down their road for a little while and bonding with them in that way. And that's different than pandering to them, is a much less violent path than just telling them the truth. So a good example of this in terms of like how these relationships often work are like a doctor and their patient. People often complain about doctors having bedside manner because on one hand they have to deliver, say, information that's horrible to people often, and then the question is how can they do that in the least violent way possible, right? So um, you could say, you're going to die in 6 months and walk out of the room, or you could have a sort of slower, more present conversation about it. And I think in our work, although it's usually not that intense and dire, um, allowing somebody to be in a very safe place, just something to think about. And there's all different versions of that, and we could talk more about that if you like. But um, a lot of questions are coming up, but just like how to deal with difficult clients, how to deal with people who aren't complying, how to deal with people who aren't getting better and don't seem not to want to get better. Of course, they're showing up, so must be some reason they're there. And so these are just some thoughts you might have on how to sort of go back in there and see their defensive as part of the process, right, of them